Our next speaker is Maria Howard, who is the CEO of the Alzheimer Society of BC. And how many, just out of interest, how many of you know about First Link? How many have participated with First Link? Well, that's excellent, but it's only about half.
I know.
Maria is going to talk about dementia-friendly communities, and this is a very interesting kind of awareness thing that we all have to be involved with doing, and she's leading a lot of that. Thank you.
Sure.
Is that okay?
Just up on my chat, so make sure they can hear you. This one. This one.
Yeah, this one. Oh, no. It's the, the last one.
Do you have a stick?
Yeah, you already loaded it. It was the dementia-friendly research.
This one?
Yeah, try that one. Yeah, there you go.
Okay, just trying to do a test.
Good morning. Yes, great. It's a pleasure to be here. It's always fun to come to these forums and share some of the work that the Alzheimer Society of BC has been doing. We really appreciate our partnership with the Alzheimer Clinic at UBC, so it's a real honor, so thank you. The vision of the Alzheimer Society of BC is a world without Alzheimer's. But until that day, our mission is to build a dementia-friendly society. And a dementia-friendly society is a place where people who are impacted by dementia feel safe, they feel acknowledged, they feel included. In other words, before there is a cure, there is care. I think it's always good to put a little bit of stats and context together, and since we are in an academic environment, I think it's important to do that too. The World Health Organization and Alzheimer's Disease International say that 50 million people in the world have some type of diagnosis of dementia. They also say that one person every 3 seconds globally is diagnosed with dementia. And furthermore, of the 50 million, 70% of people with a diagnosis of dementia in the world live in a low to middle income country. So that really starts to think about this as becoming a world crisis. In Canada, we have about 600,000 people living with some type of diagnosis with dementia, and one person every 20 minutes has a new diagnosis. I'm not going to talk about what is dementia. We have amazing researchers and clinicians here who can do this better than I, but this also raises some important information. 2 real short experiences I want to share with you. Recently, I had the privilege of going to the first National Dementia Strategy Conference in Ottawa, set up by the Ministry of Health, and 200 people were invited to come and begin to start the conversation of what a national dementia strategy for Canada should look like. Of the 200 people, there was a mix of researchers, clinicians, people living with dementia, caregivers, advocates, allied health professionals. The number one thing that came out is that we have to reduce stigma and increase awareness. Furthermore, the Alzheimer's Society of Canada ran a research survey recently, or I guess it was just a survey, and it asked people about their experience with dementia. And of that survey, 50% said that if they received a diagnosis of dementia, they would not tell anybody because they believe the stigma in society today toward dementia is still so significant that they wouldn't reach out and ask for help. So again, care before a cure is so important. The way the Alzheimer's Society of BC looks about how we can help in developing care is really in this schematic. The center is for where we say that people who are impacted by dementia are, oops, how that happened? Oh, we're going backwards here, sorry. The center is where people who are impacted by dementia live. That's people with the diagnosis, their caregivers. The outer circle are community partners, people who are already helping, who know they have a role in building care. And the outside is the general public. If we and everyone else does our roles, our jobs correctly, that center circle is going to shrink, the outer circle is going to shrink, and the bigger circle will grow. And that is where we want to, again, grow care. So how do you do that? There are really 5 ways. The first one is you need to change the conversation. We need to think about what it is that people think about when they talk about dementia. That's language, that's some of the jokes that we make. We need to change the conversation and have people talk about it in really the way it impacts us. We need to change the experience. People living with dementia who are in the community, because we know in BC 60% of people with a diagnosis of dementia live in the community, need to be able to still have the experience that they are choosing to have, whether that's going to the grocery store and not feeling embarrassed because they can't count change, whether it's going to a community centre and not being asked to or not being allowed to participate in a course because they're perceived as having some different behaviours. We need to change the experience. We need to change practice. We need to ensure that people who are providing services understand how their services impact a person with dementia. The Alzheimer Society of BC is working very closely with the City of Vancouver in our dementia-friendly communities to start developing training videos. So we have provided training videos now to bus drivers for TransLink. We have training videos for the police, for firefighters, for the administrative staff in the City Hall. And again, it's all aimed at people raising their awareness, understanding what people living with dementia are experiencing, and how do you, again, have a better relationship. We have to change policy. We have to ensure that at a government level, whether provincial or even federal, provincial and municipal, those policies support people living with dementia. That could be property taxes. That could be the way they renew licenses. That could be the way that we look at caregivers and the number of unpaid hours they give, and how health insurance is so important to cover them when they are absent from work. All these 4 elements actually change the future, and the future is research. And so how the Alzheimer Society of BC is also wanting to support research, because this is the cure, this is what is going to help us reach our vision of a world without Alzheimer's, is investing in people. The Alzheimer Society Research Program in Canada every year offers 25 grants, and it's really exciting to see that typically 1/3 of those 25 researchers are from BC, and they're young individuals who have really dynamic, innovative research projects that are looking at a variety of things, not just around a cure, but treatments, quality of life. This is so important. We also want to invest here specifically at home, and the Ralph Fisher Alzheimer Society of BC professorship is significantly important. Dr. Shung, who you heard from earlier this morning, is the recipient of the professorship now. And while this professorship is so important, it has another element to it. The person in the position needs to be both a clinician and a researcher, because they need to bring both the experience of being in the clinic and working with families and also understanding what is happening in research. But our society goes beyond that, because it's not just about what is happening in the universities or in the labs for research. It's about how we take the knowledge that is coming from research and taking that to people who are actually then going to experience it. So we want to take what is being discovered in the findings and taking it to families and people in the community, and really actually beginning to see how that makes a difference. But it's also vice versa. It's ensuring that research is dementia-friendly and that the experience of families is coming back to research. And so researchers really understand the best places to put their efforts and what is making a difference or not, and how assumptions and labels can get in the way of those conversations. So our mantra is, before there is a cure, there is care. Both are absolutely essential to be able to change the world and have our vision of a world without Alzheimer's become true. And so I ask all of you to think about your role in that. Your role is in supporting research like we are doing here today, and that's in donations and participation in clinical trials. But it's also your responsibility and your roles in how you're building care and building the conversation and sharing what you're learning with the bigger society, bigger community. So again, I thank you for your time, and I look forward to continuing to work with the Alzheimer's Clinic.